is facing a national shortage of penicillin. Now, that's the leading cure for sexually transmitted infections like syphilis and other bacterial infections. During the shortage, upstate New York has also seen an uptick in syphilis-related deaths in infants. Kendra Simpson is with us in the studio now with resources and advice to prevent these numbers from rising further. Kendra.
Yes, thank you, Teresa. The New York State Department of Health recently sent out a warning advising all expecting mothers to get tested for STIs, specifically syphilis, due to an increase in congenital syphilis, which is when the infection is spread from mom to baby. While it's fairly easy to treat and prevent, people aren't taking the precautions to do so. Depending on the stage, syphilis could be asymptomatic, so people may not realize they have it. Because of this, the New York State DOH is advising all expecting mothers to get tested to avoid risking birth defects such as neurological or developmental problems, skeletal abnormalities, or even death.
There's no reason, though, for a baby to be born with congenital syphilis because it's completely preventable. If we can get mom tested before the baby's born and treated successfully, then mom can be cured, then the baby doesn't have to worry about this.
There were 6 infant syphilis-related deaths in New York State in 2024. Halfway through 2025, the state is dangerously close to surpassing last year's rate, with 3 infant syphilis-related deaths so far. The safest and most effective way to treat a pregnant person or newborn with syphilis is with the penicillin shot created by Pfizer. But currently, the nation is facing a shortage. Creating the medicine, testing it, and producing it takes time, so the DOH is advising medical professionals to conserve this medicine and utilize other methods to prevent and treat syphilis. The DOH, Trillium Health, and other medical providers are doing what they can to eliminate infant syphilis-related deaths, but removing the stigma of the STI, practicing safe sexual practices, and regular testing are the only surefire ways to protect ourselves and children.
The bacteria doesn't discriminate against, infecting people, so everyone has a risk of encountering syphilis if they're sexually active, and so kind of keeping that in mind and employing regular testing as part of healthy sexual practices, I think can help reduce the stigma.
This isn't just a New York problem. Congenital syphilis has been a problem in the United States. What concerns me about upstate New York is this wasn't a problem prior to last year, and we see it continuing, and I think this is part of why upstate New York in particular needs to be alerted to this.
For resources and information on free STI testing near you, visit the online version of this story at rochesterfirst.com. In studio, Kendra Simpson, News 8.
Get the Rochester First streaming app today for everything you love from News 8 On Demand. Plus exclusive shows you won't see anywhere else. Search ROC and download for free on Roku, Amazon Fire, and Apple TV.